All right, well, good evening, everyone. I am really glad you've all joined us. We're going to go ahead and get started so that we honor your time this evening. One thing we've often done when we start is just try to get an idea of where approximately our participants are coming from, what part of the state, or maybe you're from out of state. During the session today, we are going to be talking about the importance of managing your health insurance. You know what your health insurance will pay for, and also know how to take the right steps to resolve and even better prevent coverage and billing questions. We have learned that about 50% of people at some point have had some type of conflict or issue they needed to resolve with their health insurance company. We planned this program so that it could kind of give you some tips and pointers on both resolving and presenting those in the future going forward. We're going to start this evening a little bit differently. As if any of you saw my email earlier, this is the first time we're offering this program. It's brand new. So we'd like to get some input from you if we could. We do this with all of our programs, but I'm going to do it a little bit differently this evening. I'm going to go to the next screen here. I'm going to talk a little bit about what we are going to do today. So today we are going to cover several things. We're going to explore strategies that you would need to use and manage your health insurance plan. We're going to talk about how to resolve health insurance conflicts. That's the main area we'll cover this evening. And finally, we'll talk about strategies that you can use to avoid conflicts in the future. We'll do this evening by really answering three key questions, probably the questions that brought you here this evening. So there are three questions that probably brought you here today, as I mentioned. First is a why. Why do health insurance conflicts even happen? Primarily, they happen because of differences in expectations with billing, but there's some really underlying reasons for why the health insurance conflicts happen. The second question we'll get to is the what. So what steps should you take to resolve health insurance coverage and billing conflicts? We'll discuss the dispute resolution process, and we'll talk about key documents that will help with that. And finally, we'll answer the how question. How can you manage your health insurance to avoid conflicts in the future? What are the actions that can be taken to help you avoid the surprises with health insurance company? So being able to answer these key questions will hopefully leave you feeling more confident on how you can manage and resolve your health insurance conflicts. So as I mentioned, the very first question we're going to address is the why. So why do health insurance conflicts even happen? And this will help because before solving health insurance conflicts or even keeping them from happening, it's really good to know the situations that cause most of the disputes that we might have with our health insurance providers. The two main areas that cause conflicts are conflicts about health insurance coverage and conflicts about charges. Now, there's a lot of overlap in those two categories. Conflicts with health insurance happen when there are unexpected costs that put our finances at risk, and these unexpected costs usually happen because of one of two reasons. Either a claim for health insurance coverage or health procedure is denied, or there's an unexpected out-of-pocket cost for a coverage or claim. Typically, those surprise charges are what happens to cause some issues with our providers. So as I mentioned before, we've learned that about half of health insurance consumers have had to resolve a conflict of some sort with their health insurance provider. So now we'll talk a little bit more about these two main reasons why conflicts happen. First, we'll talk about coverage issues. And as I mentioned, there is some overlap with the problems that cause both coverage and cost issues, but we'll talk now about coverage. So the whole purpose of having health insurance is to do two things. It's to pay for the care that you need to help us stay healthy, but also to protect your finances. So coverage itself, the word coverage refers to the services that your health insurance company has agreed to pay for. So if you have health insurance, your provider agrees to pay for certain medical, certain surgical, and preventative services, some prescriptions, and sometimes dental and vision care. Sometimes those are separate policies. Usually they're separate policies, but sometimes it's an all-inclusive plan. Not every service is covered by a health insurance plan. Your company won't cover everything. So if you plan to have a particular health service, such as a treatment, a surgical procedure, or medical device, there's some ways that you can be a smart user and check with your health insurance provider to make sure it's covered by your plan. Lisa McCoy will be covering part of this presentation, and she'll talk about some documents that you can turn to go over to discuss what your coverage is. But coverage basically means that your insurance company, coverage denial means that your health insurance company has turned you down for a particular type of coverage, and this could lead to a coverage conflict. So why are some claims denied? That's the big question. We'll break this down into a few different categories. The first one is the type of treatment that you're having. So we'll discuss the reasons why the type of treatment could lead to your insurance claim being denied. The first potential reason why a claim can be denied is because of something that you want might not be offered as part of your plan. So if you're seeking a treatment, a surgery, or something that is not part of your health insurance plan, your company may deny your claim for coverage. And you'll notice throughout the presentation tonight, I'm going to use a lot of hedging type words like may or could or might or possible, because so much of this could differ from insurance company to insurance company or individual to individual based on your needs. Sometimes it's hard to say they will or they won't. It can depend on the situation. So a treatment could be covered if it's something that's simply not part of your health insurance plan. It's not covered. Another reason why some claims are denied is what you're seeking might be experimental or outside of the standard of care. Those are related, but they're two different things. So you might need some type of health insurance coverage, but if the method or treatment, or maybe it's the surgery, is considered experimental, your health insurance company might not pay for it. It's experimental if it's not been fully tested yet, so it hasn't gone through the rigor needed to show that it's safe or effective for what you're looking for. A treatment could be considered outside of the standard of care if it's not part of the regimen that's usually offered for the type of care that you're seeking. So another reason why a claim could be denied is if it's considered to be not medically necessary. So if a treatment is considered something that you want, but it's not considered medically necessary for your health, it could be denied. And this can be a little confusing because sometimes the same procedure could be considered medically necessary for one individual, but not medically necessary for another. One example could be nasal surgery. So if it's something that's needed to correct breathing problems or to resolve migraine headaches, it could be considered medically necessary. But if it's because you don't like the way your nose looks, it may not be considered medically necessary and might not be covered. The last item in our list for the reasons why claims could be denied because of treatment issues is you might be seeking seeking care that's out of your health network. It's not something that's covered as part of your plan, it's out of network. Your network refers to the doctors or groups that your health insurer or plan has contracts with to provide coverage. And this again could also be a little tricky because sometimes a healthcare provider is in your network, but a hospital may not be, or vice versa. Sometimes a hospital is in your network, but a provider there is out of network. So we'll discuss some steps that you can take to to check beforehand if at all possible, to make sure that your provider is in network. Sometimes there are claims that are denied because of the patient or the consumer. So things that we might do, whether intentionally or not, could cause some claims to be denied. So let's talk about a few of those. A claim could be denied if you receive care without insurance. So if something happens and you need health care, but you do not have health insurance, the company's not going to pay for it. This can happen for really three main reasons. So if you have care before you sign up for insurance, you're considered without insurance. It could happen if you change companies and there's a lapse, so the claim gets sent to the wrong company. And fortunately, that's pretty easy to remove, to resolve. And another reason could be that you have expired health insurance. Payments need to be made on time. There's usually a grace period. If you miss a payment or two, you're not going to lose your health insurance. But if you let your health insurance lapse and go past the grace period for making your health insurance payments, you could lose your health insurance and it won't cover, your health insurance company will not pay for coverage after that time. So it's important to make those payments on time. Second reason is maybe you either accidentally, in this case, accidentally provided incorrect information to the health insurance company. Again, this is a little bit easier to correct than most other issues. So maybe leaving a junior off a name or a misspelling or incorrect address or some type of information could lead to a claim being denied, can be fixed, but it could lead to the initial claim denial. And another patient-related or consumer-related reason why insurance could potentially be denied, a claim could be denied, is if you give false information to your health insurance company. This could actually be considered insurance fraud if it's done intentionally, and it could cause you to lose coverage, have coverage denied, or even lose your health insurance. So it is always important to give correct information to your health insurance company. As we go on, if there is a question, please go ahead and put it in the chat box. We'll have some breaks and sometimes to stop to answer those questions. So this is the last group of reasons why some claims could be not denied. Sometimes it's because of the provider themselves. The two main issues with the providers are coding errors. Every medical procedure, everything done with your healthcare has a special code attached to it, a universal code. And there are literally thousands of them. So occasionally an error is made and a claim could be denied because of an error that way. And then also a clerical error. These both are also relatively easy to fix. It might take some back and forth, but those are two reasons why it could be, whether it could be a claim denied on the because of something that the provider, either health insurance provider or the insurance company did on their end, not your end. So we'll discuss the process for resolving this problem shortly, but we're going to play a little game. So I hope you're up for a little game. My favorites. All right, so we're going to play a little Family Feud. And the question is, what are the reasons a health insurance claim might be denied? So, let's take a moment and give you all the opportunity to either call them out or put them in the chat box. We'll play a little Family Feud. I'm glad you like it. So what are some of the reasons why a health insurance claim might be denied? I'll give you 1 minute, just throw them in there. Okay, see clerical error, out of network, coding, treatment not covered. Not medically necessary. Twenty more seconds. Lots uncovered. All right. All right, so none of those are wrong, but they're not all in the game. So here we go. First thing I have on my list is clerical error. And actually I don't have clerical error. Out of network. That one we do have. Out of network is there. Coding error is correct, but not in the game. But not covered. I know that's there somewhere. We'll just call that necessary. Experimental there. Not medically necessary is there. Lapse in coverage is and one thing that I don't think we covered, but I have it in here, so I'll just is, oh no, I changed the game. Clerical error, that was there. And the last one I have is not part of plan. So there we go. Next time we play Jeopardy. I don't have Jeopardy. I think we might have, do we have Jeopardy in another game? I like Jeopardy too. I have that in another
Jeopardy game we can try to do. We'll have to try that next time.
Yeah. We have a couple more rounds of this. I just thought Family Feud would be appropriate for something where we're trying to resolve conflicts. So with that, I am going to turn this over to Lisa.
Okay.
Your screen there.
Thanks, Dorothy. Okay, I'm going to start sharing mine. So can you stop sharing yours, Dorothy?
Yeah, I think when you hit that, it'll automatically.
Okay, I see.
Mine.
Great. Thank you. Bear with me while I share my screen. And we'll go to the. All right. So I'm Lisa McCoy, and I am a family consumer science educator and with the health insurance literacy team and with the University of Maryland Extension. And I have been with Maryland Extension for 6 years. And I actually live in Washington County and cover the 3 western counties, Washington, Allegheny, and all the way, Garrett, to the West Virginia border. So I'm happy to be here this evening, and we're now going to talk about some more things of the why do health insurance conflicts occur. And we already talked about the coverage, but now we're going to talk about the charges. So let's look about why, when you expect your healthcare services to be covered and they're not, why are there unexpected charges on your bill, even if the healthcare that you receive is covered? We all know that a surprise healthcare bill can really cause stress for us because it can be very expensive. And it also can put you in a situation where you're not able to pay for some of your other expenses that you have to pay each month. So it's not something we want to experience. So let's talk a little bit about the 4 most common reasons why health insurance conflicts are caused by those unexpected charges. So I'm going to stop my video because you all don't need to see me here. So the first one we talked earlier, Dorothy was talking about out of network, and you may have out of network service is one of the most common causes for those surprise bills, which results in a practice called balance billing. So some of these terms that we are talking about, out of network balance billing, are in one of the handouts that you received earlier called Important Words to Know. And that's a resource that helps to explain some of these health insurance terms that are difficult to understand. So balanced billing is when you are billed for the amount that's between how much the provider charges and how much your insurance will allow for that service. For example, if you see a doctor and the charge is $100, but the allowed amount is only $70 at an in-network doctor, if you're going to an out-of-network doctor, they could bill you for that difference of $30. A preferred provider that's in-network may not do that once you have met your deductible. So that's why it's important to be sure that you're getting, your providers are in-network. Another reason for charges is the deductible. You have a deductible or out-of-pocket maximum that has not been met yet. So a healthcare bill may be higher than you expect because you didn't realize you haven't met your annual deductible. Deductible is one of those other words that's on that important words to know, and that is the amount of care that you have to pay for before your insurance company starts to pay. And if you had expected the insurance company to pay the full amount of a bill, but you haven't met your deductible or your out-of-pocket maximum yet, you will be responsible for some or all of the cost of that service. So another reason is medical identity theft or fraud. And that's what it's important to review all the bills and make sure that the services that you are being billed for on there are ones that you actually received. Medical identity theft occasionally happens when someone else receives care fraudulently using your identity. If this happens, make sure that you repeat it and report it immediately to your insurance company. Medical fraud is a crime, and it's likely that they will pursue charges against the individual who committed the fraud and stole your identity. The fourth reason is errors. There are many ways that there can be errors on your bill that can cause those unexpected charges. So the first one, we mentioned about coding earlier with Dorothy. Medical coding is one of the types of coding that could be a result in an error. Every kind of care that you receive has a specific code which your provider sends to the insurance company. And there are thousands of different codes. And sometimes a code that is used may not be the best match or may be incorrect. So when this happens, the insurance company might not cover as much of the cost of care as you expect. Sometimes a dispute will arise because your provider and your insurance company have a different opinion about what is the correct medical code. Another type of error with coding is clerical error, whether coding or not, because clerical errors, it can be by the healthcare provider or the insurance company, and it can result in unexpected charges on your bill. So it could be that they put in the wrong treatment or may have had the wrong code. So it can cause you to be billed for something that maybe you did not have. Another error could be that it's a duplicate or extra charges. So this is really important when you get, you're reviewing your bills when you receive from the insurance company to make sure that you actually received all of the services that you've been billed for. And it's a really tricky, especially if you've been in the hospital, because you see many different healthcare providers, and all the doctors and other specialists that you see in the hospital usually will send you a separate bill for the care that they provided. And that's what is fair for them to do. However, it is important to check to make sure that you have not been billed more than once for the same service. And finally, it could be a case of mistaken identity. You could receive a surprise medical bill that really is intended for someone who has the same or similar name, or a different person that lives at your address. So in that situation, the healthcare provider or the insurance company just entered the wrong name into their records or sends the bill to the wrong person. And this is a really common if you have a junior and a senior in a family, that sometimes the junior may get billed for the senior healthcare service. Round 2 of Family Feud. Are we ready? So our question is, what are some of the reasons for unexpected cost on health bills? And if you want to just put in the chat there, I got to figure out how I can see the chat. Oh, here it is. So we have clerical error. Two family members with the same name. Haven't met deductible. A coding error. Mistaken identity. Well, you guys are good. Duplicate charges. So let's see what the Family Feud says. So one, we had the number 5, the duplicate or extra charges. Yay. Number 4 was mistaken identity we got. Number 3, a coding error. You all got that one. Number 2, the deductible not being met. And number 6 is identity fraud. I don't think we quite had that. So you did get some others we did not have, was coding error. Oh, you had the coding error. The clerical error and the 2 family members. So number 1 is out of network, that you did not go to an in-network provider. All right, great job. So we've been discussing the why health insurance conflicts occur, but now that we know many of those reasons, let's talk about the what. What are some steps that you can take to resolve health insurance coverage and billing conflicts? So if you have a conflict with your health insurance company, what are the first steps to take? I'm gonna hide this control here. So after you receive health care, usually your doctor or healthcare provider sends a claim to your health insurance company to cover the cost of your care. If there was a conflict over coverage or charges, you can start to solve the problem by contacting your provider or the insurance company. Your provider can usually help you, so it is often preferable to really contact that health provider first to see what steps they can take. If the provider is unwilling or unable to help you resolve the conflict with the insurance company, the next option is to contact the health insurance provider. And the question is, well, how do you know how to contact them? The customer service phone number should be on your insurance card, right there. If you can't find it, then you can also look for some helpful information on their website. So the insurance card is really something that you should have with you at all times, because that is your proof of insurance, and you never know when you're going to need it. You can't say, oh, I'm just not going to the doctor, because you could be in an accident and need that insurance card. So that insurance card provides some key information about you and your health insurance plan. So make sure that you know where your insurance card is at all times. Do you know any other information you can find on your card? Oops, didn't mean to go forward there. So I'm not able to view the chat box. So if there's anyone, if someone, Dorothy or Jesse, can tell me if people are putting anything in the chat box about what else, what other information they can find.
Copay and insurance company, PCP.
Okay, good. Yeah, so it has a lot of important information, and you need to have that because the healthcare provider will need that information to be able to bill the insurance properly. So if your provider cannot help you resolve your coverage and billing conflicts, you may need to follow certain other steps to solve the problem with your insurance company. Where can you find the answer to the questions on the screen? What information does your insurance provide to tell you what services are covered and how to manage disputes? So we've shared many reasons why a health insurance might deny a claim for health coverage, but how do you know if the care you need or want is covered by your insurance company? And how do you know if the treatment is offered in your plan or if the provider is even in network? Any ideas on how you could find that information out? And Jesse, if you can just share whatever is in there.
So some of the responses so far are their website or call the insurance provider.
Okay. Well, those are two of the top ones that we have listed. There are several places. Call your insurance company, check their website. You may be able to ask your healthcare provider if they're in network, and they may check with you or may check if the service is provided or treatment. However, everyone is entitled to receive what they call an evidence of coverage from your health insurance company. And that is usually mailed to you at the beginning of your plan year, or it will also be online, probably at their website that you can just access. If you have Medicare, you will not receive one of those evidence of coverage. So an evidence of coverage is like a contract, okay? It's the contract between the insurance company and you. And it is specific to the health insurance plan that you chose and gives you detailed information about what your plan covers, what are the costs, and what to do if you need to dispute charges. It also will tell you what you need to do if you're going to dispute coverage decisions or charges and the time frame that you need to follow in order for your dispute to be valid. So as we discussed earlier, there are several reasons why a claim for coverage might be denied. However, if the health insurance company refuses to pay a claim, you have the right to appeal the decision. If you believe that the denial was unfair, you can ask that your insurance company reconsider its decision to deny your claim. They must respond in writing to tell you why they have denied the claim, and they must let you know what steps that you can take to dispute this decision. There are two ways to appeal a health insurance decision. You can file an internal appeal with the insurance company itself, or you can file an external appeal with an independent third party. Usually you would begin with requesting an internal review by the insurance company. And the process and the time for the review depends on whether you are submitting a claim for your medical care or after, and also whether the care is urgent or not urgent. So the first step in any case is to file a claim for the coverage with your health insurance company. And usually your health care provider will do this. If the coverage is denied, your health insurance company will notify you in writing within 15 days if you're seeking authorization for coverage before you receive healthcare services. If you've already received that care, the insurance company must notify you within 30 days. If it is an urgent care, you will be notified of the denial within 72 hours. If the claim is denied, then you can file an internal appeal with your insurance company. These are required to provide a fair and thorough review, and it has to be completed within 30 days if your claim is for the care that you haven't received yet. So let's say you're planning on having knee replacement surgery and you need to see if that is covered by your insurance, then you would file that claim beforehand to see if it's covered, and then if it's denied, then you could do an appeal before you actually get that surgery done. If it is after you've had the medical care, your internal review must be completed within 60 days. In either case, your insurance company must provide you with a written decision. If your claim has still been denied after the internal appeal process, you can then decide to request an external review. So you need to request the final review within 60 days of your final denial. And the external reviewer must be state approved, and they have to meet consumer protection standards. The external reviewer has the final decision, and you will be informed of the final decision within 60 days of your request. If it is an urgent situation, they can expedite that external review, and you may receive notification within 4 days. So now I'm going to turn it back over to Dorothy. Oh no, I've got one more. Oh no, we got to play Family Feud again. Sorry. I just like that music. We have to play that music first. All right. So our question is, what are the steps in the health coverage claim process? So if you want to file a claim against the denial for the health coverage, what are the steps that you need to take? And you can just put them in the chat box, and Jesse can share what you say. So any steps that you take? All right, well, we'll start here at the fourth one. Well, first you're gonna file a claim first, and then you will get an approval or denial for that. The next step is internal appeal, and if that is refused, then you can go for the external appeal, and that is the final ruling on that. Now, we will go back to Dorothy.
Okay, thanks, Lisa. I'm glad you all liked the game, especially the music. I had a couple of comments on that. I was so excited to find it. Okay, give me a second to change over the screen. That should be it. So I assume it changed over on your end. You should have the how question. This is the last question we're going to address this evening. The question is how, because conflict is stressful. Disputes can be stressful. So we have discussed some of the main causes of health insurance conflicts and the steps that you can take to resolve them. But it's also helpful to be able to consider how to prevent them. So we'll talk now about how you can manage your health insurance so that you can potentially avoid conflicts in the future. Certainly not a guarantee because life happens, but there are some things that you can do to help lessen the chance that some of these will happen and be a smart user of health insurance. So we've talked a few times about how receiving care outside of your network can cause both coverage issues, so it may result in a denial of coverage, or it can also result in increased costs, either of those. So one of the steps that you can take to reduce the likelihood of a health insurance conflict is to check your health provider network. Lisa talked about a few different sources that you can go to determine your network, but that is definitely an action that you can take to potentially avoid conflict. Not every doctor, hospital, facility, and care service, as you probably know, is in your health insurance plan. So choosing an in-network provider is important because it saves you money. Your in-network providers, as you mentioned, are those that have a contract, already have an agreement with your health insurance provider to provide your care for you. So an additional caution, and this we brought up before, but it's worth repeating again. So be especially careful if you're in the hospital. So even if your primary doctor is in network, or if the hospital is in your network, there may be other services that are not. Sometimes you hear of radiology or pathology services, that where the provider may be out of network. So it's important to, as much as you possibly can, to advocate for yourself and make sure that you're using physicians and back office type of providers that are in your network. You can request that. Another action that you can take is, whenever possible, get an upfront estimate. It's okay to ask what your care is going to cost. Sometimes a physician might not know exactly what something might cost if they're unsure of what you might need. But as much as possible, you can get an upfront ask about the cost before treatment whenever possible, and that could help prevent surprises down the road. Thirdly is to review the evidence of coverage, the booklet that you received that Lisa discussed. So your evidence of coverage will let you know before you go what services are covered and what your co-payments and other costs will be. It should be all in there. Check pre-approval requirements. Some plans or some procedures do require pre-approval before you get them. So check to see if there is a requirement for whatever procedure you need, to see if you need pre-approval first. That could reduce the likelihood of some issues down the road if you don't get that pre-approval. So make sure you follow your own health plan provider's rules for that. So a few other things you can do. You can also file a claim before receiving care. We talked about the claim process just a few minutes ago. So the earlier you can get that started, the more you can work with any problems before they arise. So filing that claim, if you know in advance of something that you need to have done, you can file the claim first. Usually your provider will do that for you. Most healthcare providers are usually the ones that do that. You can contact the insurance company yourself. And really, in our studies, the health insurance companies, your health plans, health providers, and us as consumers, we're all in the same team. So we all want to ensure health. It just needs to be, the proper formats and procedures need to be followed. So when you can, file a claim before receiving that. And the way to do that is to file a claim first with your health insurance company, and then you'll receive your approval or you'll receive your denial. And then if denied, you can go through the appeals process. The good news is almost every claim is approved the first go around. So even though we have this program and we're talking about the steps for a claim denial, that's really the exception and not the rule. Let's go on to another action that you can take to reduce conflict, and that is to prepare for your cost, to prepare for the cost that you will need to pay out of your own pocket. So be prepared to pay those out-of-pocket healthcare costs. Most plans have a deductible. And the deductible, you can see a little bucket sample on the screen. The deductible is the amount that you need to pay for your health care before the health insurance company pays anything. And being prepared to meet that deductible, budgeting for it beforehand, can help you prepare you for those expenses and just cause less stress or conflict down the road. There are some care that is often provided without having to pay the deductible first. Sometimes certain preventative care and well visits are provided without cost and without having to meet your deductible. That's often the case. So pay your deductible, plan for that. Then know there's often a certain amount that you'll have to pay after you meet your deductible in the form of co-payments and co-insurance costs. Sometimes it's a fixed dollar amount, like $10 or $20 or $3, depending on what you need. Or sometimes it's a percent, like 20% or 10% or 30%, and that's all outlined in your evidence of coverage. And then once you meet your annual out-of-pocket maximum, then there most likely no additional costs unless you have something that's not covered under your plan. So another action that you can take to avoid conflicts is to prepare that with savings, to be prepared to pay out-of-pocket costs. So now we are ready for our last round, round 4 of Family Feud. So the question for this is, what are the ways to protect finances from unexpected healthcare costs?
So we have people say, getting insurance, find out how much it will cost ahead of time, get the estimate up front, save for copay and deductible, check provider network, budget for deductible costs, check pre-approval requirements.
I think you got them all. So,
A smart bunch today.
yes. So I'm now I wrote those down as you were saying it. Now I'm having trouble reading my handwriting. So I'm just going to go straight down because I think you got them all. So one is check provider network. The second is get an estimate of cost estimate up front, file a claim before care, budget for those out-of-pocket costs, and we didn't stress this, I'm not sure if it was mentioned, but we did mention it, check pre.
Somebody did get that.
And that was brought up, so yes. Yeah, got them all. And now I believe I turn it over to you, right, Lisa? Or do I keep going?
No, I get it next year.
I didn't know my notes right in front of me. Okay.
Yeah.
On to you. Thank you.
So we're on the final swing here. So we're just gonna kind of wrap up and review some things. Insurance management and dispute resolution strategies and how to prevent them. Some things is to really keep all your health insurance papers organized. Make sure that you know how to get to them quickly if you need to look something up. Budget for your deductible and out-of-pocket maximums that's one of the things we just talked about on that Family Feud. Track your health expenses and make sure that you're seeing what it is and know where your evidence coverage is and how you can find out if something is covered or not. So organization seems to be one of the big keys there to helping you manage these health insurance strategies. So some of the actions that you can take if you do have a dispute is, first of all, document all communication. And I think it's really important when you call the health insurance company, and I had an experience with this several years ago, is I would write down the date, the time, and I would ask the person who it was that I was talking to, and then like a brief note about what we discussed, because if you have to keep calling back about the same charge, at least you have record of what you had, who you discussed it with, and what was the resolve that they gave you. Before you start handling a conflict, write down what you want to say and try to remain calm. So sometimes we become very upset because of the charges and how much they're charging and they're not paying for it. So it's best to kind of be prepared and just writing it down so you don't forget exactly what you need to share with them. And the third is to ask your healthcare provider for some assistance with those health insurance disputes. They may be able to kind of run in between and talk to the health insurance company as well to get them resolved. We just want to share with you some reliable resources that you can use to access. And you also received a handout in your folder earlier, file that you got. Our health insurance literacy website at the University of Maryland is there on the first one. Healthcare.gov is a very good resource as well. They have a lot of good information on their website. And the Consumers Union has another one talking about healthcare information and disputes. And finally, a good resource is the website for the Center for Medicare and Medicaid Services. They have a PDF that you can download. It says From Coverage to Care Roadmap, and it kind of walks you through what you have to do to get coverage and make sure that you're getting everything that you need to have.
Well, thank you, everybody. And I just received a reminder, thank you, Jesse, that we'll be posting the presentation on our website. So it will be available. It might take a few days before it's actually posted. Take some time to prepare and get the link ready. It will be posted on our health insurance website. So thank you, everyone. Have a great evening. Thank you.